Hello, my name is Sławomir Nowaczyk. I am professor in machine learning. The project is aimed first at creating holistic understanding of the healthcare system in Holland, and second, building decision support systems for clinicians and decision makers to limit adverse patient outcomes while lowering healthcare costs. Clinical decisions for readmissions, transfers, or interventions are based on assessments of expected benefits made by individual caregivers, and this comes from their personal experiences and their knowledge. However, with an exploding body of information about medicine and with the aging population, which leads to more intricate cases, this is becoming really difficult for an unaided mind to comprehend. This raising complexity in healthcare often leads to inefficient decision-making and therefore to detrimental outcomes for patients and to escalating healthcare costs. Consequently, there is a need for smart decision support systems that can empower clinicians to make more informed choices. Decisions made not based on their personal experience and general medical knowledge, but about precise insights into the future outcomes of exactly the right patients. What we do is leverage existing digitalization of the healthcare, including electronic health records, and combine it with the modern artificial intelligence and machine learning toolsets. In the developed prediction models, the focus is on methods that can handle complexity of healthcare data. It includes heterogeneity of information, things like continuous lab results, time-stamped diagnoses, clinical notes. It includes temporality, the fact that patients visit the doctors at uneven intervals, and it includes bias in the data, namely the fact that based on economical status or sickness level, you get different amounts of information. Sometimes you get missing data or rare events. Notable methods used in the project include approaches based on natural language processing. Our recently developed method called CAFE is based on combining clinical insights with cost-sensitive embeddings. It allows a better representation, especially of rare concepts in medical health records. Initial results show 5% improvement over state-of-the-art in terms of predicting one-year onset of 11 different diseases. The project has produced several scientific publications. One of the notable ones is Resource Profile, which describes regional healthcare information platform developed in Holland. This platform has served as a backbone for over a dozen research studies and much more in the pipeline. We were able to demonstrate, in terms of clinical outcomes and personalized costs, the importance of following Social Styrelson's pharmacotherapy guidelines for congestive heart failure patients in Holland. Using the data platform, we have built several decision support systems with clinically meaningful accuracies. For example, we can rule high or low risk patients in ambulances, predict 30 days unscheduled hospital readmissions, predict onset of mental disorders in young people, and predict 30 days post-emergency care discharge mortality. This last is currently being validated prospectively in Holland. As the first project of its kind in Holland, it creates strong foundation for using machine learning and artificial intelligence in healthcare. We have published results on its use for clinical decision support, management of healthcare, and simultaneously for expanding the evidence base of medicine.